All right, and welcome back to Whiteboard Gematria. I'm your host, Dal, so let's get to it. By 2030, the immunization agenda aims to reduce by 50% the number of children missing out on all vaccines, achieve a 90% coverage for essential vaccines given to children and adolescents, introduce 500 new vaccines in low and middle income countries. The Immunization Agenda 2030 of the World Health Organization, and their printing presses leave nothing to question. Immunization Agenda 2030, a global strategy to leave no one behind, printed April 1st, 2020. Followed up by January 7th in 2021 by implementing the Immunization 2030 agenda, the framework action through coordinated planning. What is the Immunization Agenda 2030? What is the global strategy to leave no one behind? Well, according to the World Health Organization, immunization is a global health and development success story saving millions of lives every year. We now have vaccines to prevent more than 20 life-threatening diseases, helping people of all ages live longer, healthier lives. Immunization is the foundation of primary health care system and an indisputable human right. It is one of the best health investments money can buy, yet despite tremendous progress, far too many people around the world, including nearly 20 million infants each year, have insufficient access to vaccines. In some countries, progress has stalled or even reversed, and there is even real risk that complacency will undermine past achievements. This pandemic has reminded the world of the power of vaccines to fight diseases, save lives, and create a healthier, safer, and more prosperous future. Moving forward, strong immunization systems will be needed to ensure that people everywhere are protected against COVID-19 and other diseases. The World Health Assembly, with the support of countries and partners, have endorsed a new global vision and strategy called the Immunization Agenda 2030, the IA 2030, to address these challenges over the next decade and save over 50 million lives. This envisions a world where everyone, everywhere, at every age, fully benefits from vaccines to improve health and well-being. It aims to maintain hard-won gains in immunization, recover from the disruptions caused, and achieve an even more by leaving no one behind in any situation or any stage of life. The vision, a world where everybody, everywhere, at every age, reduce mortality and morbidity by vaccine preventable diseases for all across the life course. Fully benefits from vaccines is the vision, by impacting and leaving no one behind by increasing equitable access and use of new and existing vaccines. The vision for good health and well-being impact goal would be to ensure good health and well-being for everyone by strengthening immunization within primary health care and contributing to universal coverage and sustainable development. Now, how are they going to go about doing these things? Well, immunization programs for primary health care, universal health care coverage. We need to, according to the World Health uh, Organization, the WHO, to ensure adequate health workforce availability, build and strengthen comprehensive vaccine preventable disease surveillance supported by strong and reliable laboratory-based systems. All right, so disease prevention, vaccine surveillance. Secure high-quality supply chains and effective vaccine management to facilitate equitable coverage in immunization and establish synergies with other primary healthcare supply chains where possible. Generate fit-for-purpose immunization data for evidence-based decision-making. Ensure functional vaccine safety systems in close collaboration with national regulatory agencies. So ensure functional vaccine safety system. So it's interesting stuff. Commitment and demand. Build and sustain strong social, financial, and political commitment for immunization. Strengthen leadership, management, and coordination for immunizations at all levels, and ensure people and communities value, actively support, and seek out immunization services. I wonder how they're going to make that happen. Reach high, equitable immunization coverage at a national level in all districts. increase coverage of vaccines among the most disadvantaged populations, and reduce the number of children not reached through the immunization program of a zero-dose children. Strengthen policies and service delivery to provide new and underused vaccines and appropriate catch-up vaccines across the life course. Establish integrated delivery touchpoints for immunization and other public health interventions across the life course. Decrease the number of magnitude of outbreaks of epidemic-prone vaccine-preventable diseases. Ensure timely, well-organized responses to outbreaks of epidemic-prone vaccine-preventable diseases. Establish timely and appropriate vaccine services in acute emergencies and humanitarian crises. And interestingly, establish and strengthen country capacity to identify, create, and manage innovation, develop new vaccines and technologies, and improve existing products and services for immunization programs, introduce and scale up new and underused vaccines, and improved technology services and practices. All right, implementing the immunization, the new book for Agenda 2030. The purpose of this framework for action is to describe how four critical operational elements enable a successful translation of the strategy into its implementation phase achievable for the 2030 vision. Regional national strategies that prioritize actions for operational planning, mechanisms to ensure appropriate ownership and accountability, monitoring and evaluation frameworks to guide and monitor country implementation, communication and advocacy to create the necessary messaging and reinforce the required action of all the stakeholders through the decade. Implementation will initially focus on a comprehensive response to the COVID-19 pandemic. An urgent priority is the rapid and equitable scale-up of COVID-19 vaccines in all countries, as well as collective action to catch up on missed vaccinations and rebuild essential services. Rebuilding of immunization programs will make a major contribution to the strengthening of primary healthcare systems. Effective childhood and adult immunization programs will lie at the heart of resilient and sustainable primary healthcare systems that will be central to future global health security. If you enjoy my work and would like to support, you can by reaching out at PayPal. And I'm also available on Patreon if you prefer that method. I appreciate everybody who has supported me and continues to. And as I work on my next video, I hope this opens your eyes a little bit to the plan. The plan doesn't matter what's going on in any court or any rebellion on the street. The plan is a global, you saw it, a global no one left behind, no one unvaccinated world. Yeah. We're just in the very first year of this stuff, people. This is just the beginning. I can't warn you anymore, and I don't know how anyone cannot see what's going on. So I'm just as baffled and I'm just as lost for words now when we see it. It's just literally written for us to see. Show it to the people. Let them know. Show it to everybody. This is the plan, and it's on the books, and they will be shooting you up for the rest of your life. Wherever you are, I hope this finds you well. God bless.